And I would like to come in giving you magic words that would more adequately resource the HIV response globally in the region. The reality is we're living in a very, very complicated time. And we have this opportunity and all of the biomedical support and advances we need actually to end HIV as a global health crisis in our lifetimes. And yet, what we're lacking is the political will and the financial resources to do that. So this is, especially in 2025, a moment of profound transition, I would say, in global HIV financing. And as you've just heard, many traditional donor streams are shrinking or being redirected, and we're seeing the effects already appear, not just in treatment budgets, but in the very programs that drive change. So prevention, community leadership, human rights, gender justice. Um, Ironically, HIV private sector philanthropy has been in recent years at an all-time high. At FCAA, we document all of the different private sector grants made around HIV around the world. In 2023, that came out to 722 million US dollars, which had been a 10% increase from the year before. We are currently preparing our next report on 2024 grant making, and we found that it was right around that level as well. So in many ways, that seems encouraging, but the reality is really much more complicated. One, private sector philanthropy represents, on a good year, generally about 2% of global HIV financing. 90% of HIV response is from multilateral and bilateral governments. Also, the funding for the private sector hasn't kept up with inflation in recent years, and it's becoming more concentrated. So as we look at that 722 million USD that was granted globally from the private sector, only two funders alone were responsible for 64% of that. So we have a lot of dependence on a relatively small number of large donors, which is a structural risk for all of us. So here in the Asia Pacific region, I'm sad to say philanthropic investment remains incredibly small compared to the need. So we look at where resources are going in different regions. In Asia Pacific, in both 2023 and 2024, we have found private sector investment came out to $2 USD per person living with HIV per year in the region. That is the lowest compared to any other region around the world. That's not an ecosystem of donors. That's a warning. So the reality is we need to be talking much more with the private sector about what the needs are in the region, what the investment opportunities are, so that we can increase those resources in the years to come. So a couple notes as traditional donors shift, as we see a lot of challenges in private sector grant making. I know everybody's thinking, how do we bring more donors to the table? So there are a few things I just wanted to note quickly. One is to note that philanthropy is under duress too. Just about every community, every region is impacted by a lot of the cuts that we've seen from donor governments this year. And while private sector philanthropy is quicker to respond than overseas development and bilateral, multilateral funding, doesn't mean it's fast enough. So many of the donors are still figuring out how they want to respond, where they need to respond. So while it can move faster, I would say right now we all know it's not fast enough. Also, philanthropy is not a safety net. It's very relationship driven, narrative driven. So I think there are opportunities for groups on the ground is to think about, how do you tell your story, help bring the communities that you serve to life. It's one of the reasons I love this campaign and the videos. Funders don't respond to a list of gaps, especially when there are gaps everywhere. They respond to a compelling story about impact and a clear sense of what their funding could do. So rather than starting with, we've lost funding, help us fill the gap, instead think about talking with them about what their investment can achieve. Stronger prevention, fewer infections, reduced burden on treatment systems, and show your theory of change. So show how you're going to do that, knowing that your work is absolutely essential and deserves to be funded. Um, the reality is we know funding is going to go first to treatment in many moments where we're concerned that that's at risk. But we also know, and don't we tell donors all the time, treatment alone is not a response. Without prevention, the treatment queue will grow. Without gender and rights work, people will fall out of care. Without community-led monitoring, we can't see what's working. So if you're seeking funding for those areas, reframe your work or frame your work as risk mitigation. Help people see that this is not add-on work; it is essential work. And where you can help connect donors in the region and new donors to see why the work with people impacted by HIV connects with other philanthropic priorities, whether that's climate, democracy, gender equality, human rights, because we need to bring more donors to the table to support the people in the places most impacted by AIDS and to increase support specifically for the Asia Pacific region.